Hello. Today we'll continue with our series of lectures on behavioral science. This will be lecture number 4, and we'll be covering the topic of developmental psychology. Actually, this topic will be divided in 2 lectures. The first lecture will be from pregnancy through preschool, and the other lecture, which will be the next one, will be from preschool all the way through death. um, I tell you in advance that my voice is a little bit hoarse. I mean, this is not the way I usually speak. I've had a flu recently, so my voice is a little bit affected. But I ask you to bear with me. And if you stay with me, I think we can pull it through. So, developmental psychology is an important aspect of behavioral science, and it mostly deals with the most important milestones in the lifetime of an individual. I mean, we all are born, we all grow, and we eventually die. In other curricula, this is sometimes called human growth and development, and there are curricula that include a complete course on this. Here we're only going to dedicate a couple of lectures, but I must tell you that this is a very important aspect of psychology, of the field of psychology. And you as doctors need to be aware of some of the most important topics here, especially those of you that are planning to be pediatricians and also psychiatrists, because there are some disorders, some mental disorders that originate in childhood. So it's important for you to know what is normal in childhood and what is not normal in childhood development. So we'll take a look at some of the most important milestones and aspects of development as the child grows into older age. So let's begin with the period of life before you're born, and that is pregnancy. Well, during pregnancy, mothers go through some mood changes, and they can be due to 2 reasons. First of all, they can be due to hormones. As you know, during pregnancy, there is a lot of hormonal change involved. And of course, the psychological is the biological. Now, if there are biological changes in your body, that will ultimately also influence the way your mind works. So if there are hormonal changes, there will also be mood changes in pregnant women. And of course, there are also psychological changes when women are pregnant. I mean, this is something not entirely new for people who've already been pregnant, but especially for women who are pregnant for the first time. That there are big psychological challenges in there. So all those sources of stress and anxiety, but also happiness, all that can affect the mood changes. So in pregnancy, you should expect mood changes in women. And I can tell you from personal experience, I have 2 daughters, that yes, my wife went through some intense mood changes, and husbands have to cope with that. So it's a challenge for the women, but it's also a challenge for men. There are some cases of pseudocyesis, or as it's more frequently called, false pregnancy. Now, they are of very acute interest for psychiatry. In the past, they used to be called hysteric women that became pregnant. That's the way it used to be referred to. Now, that terminology is not used anymore in the clinical settings. They're now called somatoform disorders, and that is to say mental disorders that have consequences on the body. So the women somatize some of the mental stress that they may go through. And there may be a few women in the past when these women used to be called hysterics, some of them had false pregnancy. Now, there are some cases of false pregnancy, but they are very rare. And it may occur in women with a strong desire to be pregnant. So, their belly may increase. They may have the appearance of having a fetus inside their womb. They may even have some hormonal changes and mood changes. But when you run a pregnancy test, it turns out to be negative. So you as doctors should watch out for some false pregnancy cases. I mean, just because a woman has the appearance of being pregnant, that doesn't necessarily mean that she actually is pregnant. During pregnancy, women also develop a very strong bond with the unborn child. And although abortion is not necessarily a traumatic experience, and there are some myths about abortion that, if women really knew what it would be like to be pregnant, they would never abort, or if women really knew what it would be like to have a baby, they would never do it because they're always attached to their babies. Although abortion is not necessarily traumatic, and there's no evidence that points out that really having an abortion will devastate your life. That's a myth put forth by people with an anti-choice agenda. It is nevertheless true that those women who do decide to have a child, they develop a very strong bond with the unborn child. So this is something that you physicians always need to watch for as well. I mean, and you need to be sensitive enough about the feelings of the woman towards the unborn child, because there is a very strong bond with the unborn child. Usually physicians recommend not having sex 4 weeks before giving birth because, well, the coitus movement could affect the health of the fetus. Men may be uncomfortable because of this. So, well, I can tell you, as in my personal experience, and when the doctor said that we shouldn't have sex 4 weeks before my wife's birth delivery, yeah, I became a little frustrated over that. And statistics tells us that yes, that men do become a little bit uncomfortable because of this, and the statistics do show us that there is a higher incidence of extramarital affairs during this time. So psychologists and counselors need to work on this in order to make sure that the husbands are able to cope with this uncomfortable situation, and that they eventually pull it through. As I was telling you, there are some psychological changes during pregnancy, and it doesn't only regard moods in women. There are also other changes. So first of all, the sense of identity is altered by the knowledge that another person is growing inside the pregnant woman. So the woman doesn't usually think of herself as only one individual, but she also thinks of herself as the host of another individual. So she begins to understand that inside her there is another person. Now, we may have a long discussion about whether or not the fetus is really a person and whether or not abortion is moral or not, but that's not the point here. The point is that it is nevertheless true, regardless of what you think of abortion, that the women, pregnant women who do want to have a child, their sense of identity is altered. I mean, they begin to understand that inside their own womb, there's someone else there, and that they form sort of like a team. Okay, the two are together all the time. Uh, it's also true that for the most part, parents are willing to make enormous sacrifices for the good of the child. And this is probably so for evolutionary reasons. I mean, in evolution, those behaviors that contribute to the spread of genes then turn out to survive in greater proportion. And of course, if you are very caring of your children, then that behavior has a good probability of reproducing itself, because that behavior contributes to the spread of the gene itself. So, as very much as Richard Dawkins would say it in The Selfish Gene, which is a famous book about altruism, parents are very altruistic towards their children, and especially towards their unborn children, because they're willing to make enormous sacrifices. But in fact, that's a very selfish way of behaving, in the sense that the gene increases its probability of reproducing itself. And that's why Richard Dawkins' book is called The Selfish Gene, because from an individual's point of view, it may be an altruistic behavior, but from the gene's point of view, it's a selfish behavior. Now, bear in mind that this is a metaphor. I mean, I'm not saying that, and neither is Richard Dawkins saying that the genes are actually conscious beings, but it's a metaphor to say that those behaviors tend to stay in the gene pool because they are good for spreading genes. Okay, there's also among parents other psychological changes that imply an enjoyment of good parenting as a child increases probability of good parenting now. So those parents who had those those people who had good parents are more likely to be good parents themselves. Now, this is not a rigid rule. I mean, you may have had good parents and turn out not to be a good parent, or vice versa. But for the most part, those people that receive good parenting also provide good parenting. Uh, and also, there are other circumstances that may increase the way a man or the husband attaches to the unborn child, because even if, no matter how committed a man is to the unborn child, the fact that he's not actually carrying the child within his body makes him a little bit less attached to the unborn child. I mean, and you see all cultural depictions of that. You see, for instance, there's a famous painting by Goya where Saturn, the god Saturn, eventually eats his own children. Now, you will probably never see any cultural story or any cultural depiction of women eating their own children. But with men, there have been a few cultural depictions of that. Now, uh, this may be so because it reflects a natural tendency for women to be a little bit more caring of unborn children than men. Because, as I was saying, the sense of identity is altered in women. It's not so much altered in men. But nevertheless, I mean, that does not imply that men do not also make sacrifices for the good of their unborn child. And there are some social circumstances that increase man's attachment to the unborn child. Ultrasound visits or visits to the gynecologist or the obstetrician also increase man's attachment to the unborn child. I can tell you as a personal experience that when my wife was pregnant, I always went with her to the doctor, and really seeing the baby in the screening tests and talking to the doctor and so on, that really increased my commitment to support my wife during pregnancy, and also my attachment to my baby. I have to admit that right now I'm very attached to my kids because they have grown, but I have to admit that when my baby was born, I didn't find the babies to be all that beautiful. And let's face it, babies are not terribly beautiful when they're born. So it is there might be a natural tendency for husbands, for fathers, not to feel all that attached to the woman, to the baby. But there are social circumstances that can help with that. And there are also evolutionary reasons. In evolutionary psychology, um, a lot of authors talk about parental uncertainty. Now, the mother never has this uncertainty because she can be absolutely sure that the baby that she is taking with her is actually her own. But with parents, with fathers, it's different. There's always the issue of parental uncertainty in males. And that, to a certain extent, prevents them from developing a full attachment to the unborn child. It would be interesting to find out, and I don't know what the studies say, but it would be interesting to find out whether surrogate motherhood uh, changes the attachment, the level of attachment of the pregnant woman with the fetus that inside their womb. Because I mean, if they, in the back of their mind, they have the idea that that fetus is not really genetically related to them, then it would be interesting to find out how that changes their behavior. I don't know. I mean, we would have to look at the results. Okay, let's talk about infant mortality. Well, infant mortality, or the rate of deaths in newborn children, is usually related to a lack of universal health care. So in those countries that do not have universal health care and that have poor socioeconomic conditions, then obviously infant mortality there is increased. And it's also correlated with low social economic conditions. So even in developed countries such as the United States, well, infant mortality is higher among groups that have lower social economic conditions, such as Hispanics or African Americans, and it's lower in groups with higher social economic conditions. I don't know how it works in the United States, but in Latin American countries such as Venezuela, my country, Some Native American groups, for instance, and some very impoverished people choose not to go to the hospital, but to deliver and to have the baby in their own houses. And that of course increases the risks and dangers. And that also has a cultural component. I mean, if you come from a social economic group with that's in the lower with low social economic conditions, it's not only the absence of healthcare, but it's also the cultural habit of not going to the doctor and not trusting doctors. So social economic conditions and cultural conditions are related to the lack of are related to infant mortality. Cesarean birth used to be more frequent in the United States because doctors consider it a way to avoid lawsuits. Because, yeah, there may be a little bit more risks in vaginal normal birth. But now in the United States, it's becoming less frequent. I can tell you that my wife, both my kids were born with a cesarean birth because, of course, once the first kid is born with cesarean birth, every other kid after that needs also to be born with a cesarean birth. I mean, vaginal birth is not possible after cesarean birth, or at least it's very, very risky. So in Latin American countries, there is a tendency to overuse cesarean birth. But as I said, this is changing in the United States, and I think the consensus among doctors is that it is indeed being overused. Well, because it decreases some risks and lawsuits, but the doctor should also consider, and this is a consensus among doctors, that it also has some other risks. So, cesarean birth should be applied only when it's actually needed. Apart from infant mortality, there's also the risk of premature birth. How do we define premature birth? Well, we define premature birth when a baby is born less than 34 weeks of pregnancy and he weighs less than 2,500 grams. And very much as in infant mortality, there is a higher incidence of premature birth in more vulnerable populations. So, in the United States, African Americans, Hispanics, Native Americans, and in Latin America also, blacks, Indians, and so on. And in Europe, in Spain, for instance, gypsies and people who are in the lower scale of the social hierarchy. Uh, uh, this also has to do with the fact that premature birth is usually associated with not good conditions during pregnancy and not good enough medical screening. So people who have poorer levels of nutrition, people who have less access to healthcare, then they have a higher risk of having a premature birth. And of course, having been born prematurely also has a lot of risks. So children born prematurely are at a greater risk for later complications. Okay, let's talk about the depression for women after having given birth, the so-called baby blues. Well, it's quite normal for women after having given birth to have some depressive episodes. It may last up to a week after birth. These are the so-called baby blues. And of course, this is due to a lot of reasons. First of all, there are psychological factors. I mean, after a woman gives birth, she has a lot of responsibility. She has to feed the baby at least every 3 hours. There's a lot of stress because of the immense responsibility and the intensive care that parents have to provide on the baby. If the woman is a single mother and she does not have the support of her husband or of the family, that may also increase the stress. Uh, and of course, it's a huge responsibility. I mean, the baby has to be fed every 3 hours. People usually joke about about sleeping as tight as a baby, but I don't really get the joke because a baby wakes up every 3 hours. That's not sleeping tight. So there are psychological factors that these are the psychological factors that influence over the baby blues. But there are also physiological factors. I mean, again, hormones go through there are some major hormonal changes during pregnancy and after after giving birth to a baby. And of course, hormones have a deep connection to mood states. So the hormonal changes may eventually also influence over the baby blues. Um, what's the treatment for these depressive episodes? Well, it's mostly the support from relatives and the husband. I mean, here for baby blues, no pharmacological treatment is needed. And this is pretty much normal. I mean, you should expect almost every woman to have at least 1 week of mild depression after having given birth. Now, this can become a little bit more serious if it goes beyond a week after birth. And a more serious condition is called the postpartum depression and postpartum psychosis. We will not delve too much into this because we will cover this when we talk about mood disorders later on, and the DSM-5 has some specific criteria about how to diagnose either depression or psychosis. But for the time being, it's enough to say that the depression is a disorder or mental condition that has a persistent symptoms for a given period of time that goes far beyond a week. And psychosis, it's even more extreme. It's not so much a mood disorder, but more of a loss of touch with reality. So the baby blues may become into a postpartum depression when um, the woman, the mother, develops some of the symptoms that are typical of depression, such as not having the ability to feel pleasure, and either not having difficulty with sleep, or not having appetite, or eating too much. And not having being a depressed mood, and so on. And psychosis, well, it can be either a delusion or even hallucinations, or just loss of touch with reality. So in those cases, psychological treatment is not enough. The doctor may have to prescribe either antidepressant medication. We'll cover this later on, but probably the most frequently used are selective serotonin reuptake inhibitors, or SSRIs. The most famous one is Prozac, although that's not the generic name. The generic name is fluoxetine. And also antipsychotic medications in the case that the patient is becoming psychotic after having given birth. So we can say that there are three types of maternal reactions according to the intensity. Baby blues, well, during the baby blues, which can only last for a week after delivery, there is exaggerated emotionality. So, the woman may cry over some meaningless detail, but, she feels she's quite sensitive and she may cry. So, she's very stressed and very anxious about the great responsibility that she has now. So, she may be very emotional. The more serious condition is postpartum depression, and in that case, well, the symptoms may be hopelessness, lack of pleasure or interest, and the direction it would be up to a year if it's not treated. But if it's treated, you can expect it to recede after 3 to 6 weeks if it is treated. Postpartum psychosis, remember, psychosis is different from depression. Depression affects the mood. Psychosis affects the mental state and the touch with reality. Well, some of the symptoms may be hallucinations, delusions, and this may become dangerous because a woman who's suffering from postpartum psychosis may harm the baby. Usually the duration of this is up to 1 month, but because of its serious dangerous potential, then the doctors should take note of this, and if necessary, prescribe antipsychotic medication. Okay, so after the baby is born, let's talk about some of the most important milestones in their development, and let's talk about the period from the moment they're born until a year and a half, or more or less from 15 to 18 months. First of all, there is bonding. that's the first task a baby has as soon as they're born, to bond with someone. And of course, the person who they will probably bond with is the mother. So bonding may be affected due to family problems or if the baby is too vulnerable. And there's a consensus among psychologists that those babies that are not properly bonded with during their earliest phases of development will eventually develop both psychological and physiological problems later on. So bonding is extremely important for newborn babies. It is extremely important that the caregivers, either the mother or the relatives or the husband, really show signs of attachment to the baby so that the baby will also feel attachment to those people. Um, Attachment is so important that from 6 months old to a year old, the baby or the infant will protest if he's separated from the mother. So the infant may become depressed if separated from the mother. This is called anaclitic depression, and this is something that adoption agencies should always watch for, because it may be traumatic for a child to be separated from his mother after some period of attachment and then given to someone else. So attachment is something very important to consider here. When the baby became depressed, when he was separated from the mother, in the past, people used to think that this was what they used to call hospitalism. And the idea was that because there was something in the hospital that made the baby uncomfortable and the baby would get depressed. But we now know that being in the hospital is not the issue. The issue is not being attached to the mother. So that's why after giving birth, the medical procedure is, if the baby is healthy, is for the babies to be separated in incubators in order to avoid any risk of infection. But also the mother needs to spend some time with the baby. So for instance, at least in my case, my kids were born, they were separated, they were kept in some incubators to protect them from infections. But every day for about 3 or 4 days after birth, they were taken to the mother so that there would begin a process of developing an attachment of bond between the mother and the child. And psychologists have talked have talked a lot about attachment. There was a very famous psychologist. His name was Harry Harlow, who did some very interesting experiments. Harlow took some monkeys and he took them away from their real mothers, and he provided them with two surrogate mothers. One mother provided the monkey with milk, but the mother was made out of a bunch of wires. The other mother did not provide milk to the monkey, but it was furry and it resembled more a real mother. So Harlow wanted to find out which one of the two mothers, of the two surrogate mothers, would the monkey prefer. And here's a picture of the monkey with one mother and the monkey with the other mother. And some psychologists expected, especially the behaviorist psychologists, they expected that the monkeys would prefer the mother who provided milk. Very much as in, we'll talk later on about behaviorism. There were some experiments done with rats, and the rat would pull the lever every time the rat was provided with food. So the behaviorists believed that with monkeys and their mothers, it would be the same. They would choose that mother that provided milk. But it turned out to be a different case. The monkeys invariably prefer the mother that did not provide milk, but that resembled more a real mother because of its furry nature. Now, the conclusion that Harlow drew from this experiment was that attachment is a primal need, at least among mammals, but I think this should apply to a greater number of animals all across the board, and of course, even more so to human beings. And he hoped to prove with this experiment the importance of attachment when it comes especially to infants. So the experiments also show that monkeys raised with surrogate mothers do not develop normal mating. Uh, and that's, I think this may also apply to human beings. I mean, as when people who are not fully attached to their mothers eventually turn into adults, they may have some difficulties later on, not only with mating, but with other areas of life. Males were more affected than females in these experiments. So infants separated from their mother, males suffer more than females. Somehow females need attachment, but not as much as males. And I don't know. I am very attached to my mother, so I can speak to that. There were some other psychologists later on, for instance Freud, who also repeated this idea. They say that the mother boy attachment may be greater than the mother daughter attachment. I'm not so sure that's true for the reasons that Freud said it was true, but it does seem to be true that males are more affected by withdrawal of attachment than females. Children without proper mothering, that is to say, children that are raised in orphanages or that are not giving enough attention, etc., those children are at greater risk of mental retardation, or as it's now called, intellectual disability, and poor health. And there have been some studies done in the kibbutz in Israel. The kibbutz are rural communities in Israel where parents give their children to be raised communally. The idea here is that communism is a good thing and that communism should start in education from the earliest phase of development as possible. So in the kibbutz, the parents give away their children and they're raised not by parents in particular, but by some sort of by nurses actually. And there was a famous psychologist, his name was Bruno Bettelheim, who did a study on kids who were raised in the kibbutz. And he found out that they tended to be a little bit more insecure. They did not have serious problems. I mean, the condition was not all that serious. But nevertheless, the kids who were raised in kibbutz were a little bit more insecure. And Bettelheim's hypothesis was that this was due to the fact that they were not feeling attached as normal children during their infancy. So children without proper mothering are at greater risk of mental retardation and poor health. Now, foster care tries to fill the void so that children may feel attached. And this is why adoption agencies should insist on the importance of attachment with the replacement parents. Because, I mean, it is somewhat of a trauma for a kid to be separated from the mother with whom they're attached to bringing a new parent. So this is something that should be watched for. Okay, so let's talk about some other phases of development during infancy. One of the most important milestones in the normal development of infants is the development of reflexes. So there are motor, social, and cognitive development. The development of reflexes is actually a motor or development, but there are social developments in the sense of how people relate, of how babies relate to other people, and cognitive development about how they process information in their mind. So let's take a look at a few of those. Let's take a look first of all at the motor reflexes. There's first of all the palmar grasp, and that is when a baby has the hand and you put the finger really close to their hand. The child's finger grasp objects placed in the palm. You've probably seen all of this. I mean, babies are always moving their hands so they can hold whatever object is placed near them, especially if it's a finger. But it's not only a finger, it can also be a pen, a pencil. The baby will always move its hand as if to grab it, okay? This palmar grasp usually disappears after 2 months, but especially those of you that are planning to be pediatricians, you should look for this palmar grasp because it's a normal aspect of development. If this is not, if a baby does not show the development of the palmar grasp, then there might be reason for some neurological concern. Another important reflex is the way that the child's head turns in the direction of a stroke on the cheek as though seeking a nipple. I've done this with babies a lot of times. I mean, you have the baby and then, you caress his cheek or you touch it a little bit and the baby will immediately turn his head as if that were a nipple. Because obviously, I mean, the baby's stimulated and he wants to suck. And of course, he's looking for the mother's breast. So whatever object you place on the nipple, not on the nipple, I'm sorry, on the cheek, the baby will come to process it as if it were a nipple because he wants to be fed. So it's quite normal for the baby to have this reflex, and this usually lasts until they're about 3 months old. So this is another reflex that the physicians should be aware of. And if they don't have a normal development, then there's some reason for concern, and some further studies must be done on this topic. There's also the moral reflex. This is one of my favorites. When the child is startled or uncomfortable or he doesn't like something, then the arms and the legs extend, so they're come almost like in a crucified position. So their arms are extended and also their legs. Uh, this usually disappears after 4 months, and you can do it. I've done it with my children. You can do it with whatever children you encounter in practice, or any of your relatives. I mean, if you put a baby on a bed and they feel uncomfortable and they don't like the situation, they will do like an X. They will put their body in the shape of an X. I mean, their arms will be spread and so will their legs. That's called the moral reflex. And again, pediatricians in their routine checkups, this is something that they usually do with newborn babies to check that their reflexes are actually working well. If the reflexes are not there, then again, that may be a reason for concern, and some further studies might have to be done. Usually, this reflex disappears after 4 months, so they should be screened before they're 4 years old. I'm sorry, 4 months old. And there's also the Babinski reflex, and this is the dorsiflexion of the largest toe when the plantar surface of the child's foot is stroked. So if you take a child's foot and you tickle it a little bit, they will move their toes in upward movement so that it is a response to that stimulus. And this usually lasts until they are 12 months old. I mean, if you hold, I've done it on myself. If you hold an adult's foot and you tickle the plantar surface, or the bottom part of their foot, that's probably not going to cause an immediate reflex on the adult. But with babies up to 12 years old, up to 12 months old, yes, they will do a dorsiflexion of the largest toe. I mean, they will move it upwards. So here is an outline of the most important milestones a baby goes through in their development. So from 2 to 3 months old, they lift their heads when lying on the stomach. They have what's called the social smile, but that's actually a reflex. I mean, that's not that they're really smiling at people. So they may move their mouth and to resemble a smile. That's called the social smile when they're in front of other people. But again, it's actually a reflex. It's not something that's really learned. And as far as verbal and cognitive development goes, well, a 2, 3 or 3 months old baby just gurgles. I mean, you're not expecting the baby to speak at that stage. From 5 to 6 months, the baby begins to turn over. He may begin to sit unassisted, and he grasps objects with the entire hand. As far as social development goes, they form attachments to the primary caregiver. We've already talked about that. And they recognize familiar people. They're not able to speak yet, but they will begin to imitate sound, and they may begin to use gestures. From 7 to 11 months old, they may begin to crawl. This is different among each baby. I mean, my kids, they took a little bit longer to walk, but some babies have these developmental tasks. They come sooner. I mean, what's important here is to know which is the window of time. So it's between 7 and 11 months. You can expect them to begin crawling. They transfer objects from one hand to the other. As far as social development goes, they have a stranger anxiety. This is something very important, and you should always watch for this. I mean, when the baby's attached to the mother and then some unknown person comes in and they take the baby in their arms, you should expect a normal baby to feel uncomfortable with that. So they will feel anxious with strangers. And they may also begin to play in social games. Now, it's important here to bear in mind that these social games, they still do not have the cognitive capacity to play social games with other people as such. It's more likely that it will be parallel games. I mean, they may sit together to play, but each child will be concerned with their own play without interacting really with the others. As far as verbal and cognitive development goes, well, they begin to imitate sounds and they also use gestures. From 11 to 15 months, you can expect the baby to walk unassisted. There are some walking aids that most pediatricians do not recommend. So I wouldn't recommend using the walking aids. They're not really walking machines. I don't know what you call them in English, but they're like platforms that have wheels in the bottom and that allegedly helps the baby walk. But I don't think any pediatrician or any traumatologist would agree that that's good for the baby because that may actually lead to some injuries. So it's highly not recommended. As far as social development goes, again, the baby continues to have separation anxiety and they begin to say their first words and they may begin to understand the first words, and usually the first words are their own names and the names for their mother, mommy, daddy, very basic words, but you can expect them to have language development at 11 or 15 months old. Later on, when we study some of the disorders that originate in childhood, we'll find out that the DSM-5 has some disorders on language development. And for instance, my child was diagnosed with one of those. So that may require therapy. And if you catch it early on, then it may be easily treated. So those of you that may go into to become pediatricians, um, this is something to watch for, the development of language beginning at 11 or 15 months old. They're not going to speak all of a sudden, but they may begin to issue the first word and also understanding the first basic word. Okay, let's talk about some of the theories of development that psychologists have talked about when it comes to describing how a child develops. One of the most important ones was from Sigmund Freud, and we'll get back to Freud because we'll dedicate a whole lecture to psychoanalysis. But for the time being, it's suffice to say that Freud developed a theory of psychosexual development. According to Freud, a child develops according to which area of their body or which part of their body they they fixate the most on. So at first they're very fixated on the mouth, and that's called the oral stage. Later on they're fixated on the anus, and that's called the anal stage, and that's when they learn to control. They learn how to control, going to the bathroom and so on. And there's the phallic stage when they discover their genitals, and according to Freud, this was the stage of life when both boys and girls developed an animosity towards the parent of the opposite sex. He called this the Oedipus and the Electra complex, and we'll get back to this when we talked about psychoanalysis. There's also the latency era, or the latency stage, when kids are not so much interested in sexual issues anymore, and they prefer to engage in play with children from their own sex, and they're not interested in children of the other sex. And then when puberty comes, the genital stage, when they begin to go through some sexual development, and they start to become interested in people of the other sex. But perhaps the most important theoretician of psychological development was Erikson. Erikson, he developed a system of categories of opposition of how people go through their stages of life. Okay, so in the first stage, according to Erikson, the baby has to decide whether or not to trust other people. So this is the stage of trust versus mistrust. In the second stage, which is from 2 to 4 years old, the child begins to develop a sense of autonomy, and he has to figure out how to develop that sense of autonomy versus shame and doubt, versus what other people may think of him. By the time he's 4 or 5 years old, he has to figure out whether or not to take initiatives in social activities, or whether and how he will handle guilt when it comes to taking those social initiatives. From 5 to 12 years old, the child will also have to figure out how to become industrious, that is to say, how to become involved in other activities, and whether or not how to handle inferiority complexes that may arise out of his initiative in being industrious and in initiating new activities. During the period of adolescence, that's the period when teenagers begin a sense of identity of who they are. And, some of them may become baseball players, rockers, all those cultural tribes that are usually seen in high schools. And the opposition of this is role confusion. I mean, who do I want to be, but also how will I handle who I want to be? What will be my role? How will I avoid confusion in the playing of roles? Early adulthood is marked by intimacy versus isolation. Here people have to decide whether or not they want to find a lifetime partner, whether or not they should get married or not, or whether they prefer to live on their own. During adulthood, which is from 40 to 65 years old, or middle adulthood, this is when people go through the famous midlife time crisis. And here they have to decide about whether they should give priority to generativity or stagnation. I mean, to keep on working, to keep on producing, or just to let a new generation come over and take over. And from 65 years old all the way to death, ego integrity versus despair. This is when people evaluate their previous experiences in life and whether they feel or not satisfied with what they have done in the past. Another very important theoretician of developmental psychology was Jean Piaget. And Jean Piaget, he talked about three basic phases in the development of a child. First of all, there's the sensory motor stage, and that's when children develop what's called object permanence. When you hide an object from a child, very young children will think that the object has disappeared, as if magic. An important milestone in the development, especially in the cognitive development of children, is to understand that when objects disappear from their sight, they stay there. So that's called object permanence. There's also the pre-operational stage, and this is when children begin to understand that some qualities retain or some objects retain their qualities. So there are some very famous experiments where Piaget had water in an elongated glass, and he took the water from that elongated glass and he poured it into another glass that was not as elongated but was more flat. And he would ask the child which one of the two glasses has more water. And kids who are still in the pre-operational stage, they would say that the elongated glass has more water, although the volume of water is the same. So that ability to understand that objects remain and keep their properties despite some changes in shape, that period of life is called the pre-operational stage. Now, as children mature and they enter into the operational stage, they begin to understand that objects conserve their properties, and that's the beginning of formal abstract thought. So they can do some basic math operations and they can do some basic logical operations that children in the pre-operational stage are not usually able to do. Okay, so let's continue talking about some of the milestones in development from 15 months to 4 years old. When it comes to attachment, by the time they're 3 years old, the toddler is ready to be separated from the mother. By the time they're 18 months, they're able to throw a ball, they're able to stack blocks, climb stairs 1 foot at a time, They move away from the mother, but they return to her, and this is called reapproachment. Yeah, some kids they want to be a little bit independent, but then they eventually found out that it's not so easy being on their own, so they eventually come back to their mother, seeking more attachment, and this is called reapproachment. When it comes to language, they usually use about 10 words, and they begin to be able to say their own name. By the time they're 2 years old, they're able to kick a ball, they balance on one foot, they stack 6 blocks, and they learn to use some eating utensils, spoon and fork. They learn to say no, they play with each other, but not real interaction, just parallel play. They should be able to learn 250 words, speaking 2 words sentences, and name some body parts. If they're not able to do this, then you should think about some language disorder, which is specified in the DSM-5, which are the criteria in order to do so. By the time they're 3, they should be able to ride a tricycle, they should be able to undress and partially dress, identify colors, they should have fine motor skills with their hands, that is to say using scissors, crayons. And this has some neurological correspondence, and this is something to watch for, fine motor skills. They have a sense of self as male or female, gender identity, and this may become a problem later on with the gender dysphoria, which is a mental disorder that is diagnosed, and the criteria is specified in DSM-5. We'll get back to this in future lectures. They achieve bowel and bladder control, so they learn how to go to the bathroom. They can spend part of the day with adults other than parents, so they don't have the separation anxiety anymore. They're okay with other people. They don't have stranger anxiety anymore. They should be able to use about 900 words in speech, and they should be able to speak in complete sentences. By the time they're 4, they should be able to dress independently. They should be able to have a minimum level of grooming, that is to say, washing their hands and maybe brushing their teeth and so on. They should have cooperative play with other children, that is to say, this is no longer just a parallel play that each kid plays on their own. No, they should be able to engage and play with other kids. They should have some curiosity about sex differences, and this is a time when phobias begin. So kids might have some nightmares as well. And they should already, by the time they're 4, they should already have some good verbal expression, that is to say, a good use of language. By the time they're 5, they should be able to draw, and of course, in order to draw, they need to have fine motor skills. They should be able to hop on one foot. They should be able to go down the stairs with both feet. It's quite common that they develop romantic feelings about the opposite sex parent. This is what Freud called the Oedipal stage, although Freud's interpretations of this stage have been severely questioned. But it's nevertheless true that at this age, when kids are around 5, they do begin to develop some feelings, romantic feelings, not necessarily sexual feelings, but some strong feelings of attachment to the opposite sex parent. And they also become afraid of being injured. And they should also have more fluidity in language. By the time they're 6, they should have more advanced fine motor skills. So this implies tying their shoelaces. They should be able of learning how to ride a bicycle. They begin to develop a sense of what's right and what's wrong. And this is important when we later get to conduct disorder, which is, it can be loosely defined as a disorder that is, let's say, the prior stage to antisocial personality disorder. So kids that are diagnosed with conduct disorder, they don't really have a moral sense. But you shouldn't expect children to have a moral sense of right and wrong before they're 6 years old. And at this stage, it's also the time when they begin to develop reading and writing skills, and also logical thinking, which is about the same time when, according to Piaget's phases, children begin abstract thinking. So that should wrap up our lecture today. Let's do a few questions that resemble USMLE questions, and from then on we'll take it. So let's consider the first question. These are questions that are very similar to the ones that appear in USMLE Step 1. You conduct a well child checkup on a normal 4-year-old boy. He is most likely to show which of the following skills or characteristics? A, to identify colors. B, to read a 3-word sentence. C, to refuse to play with girls. D, tying their shoelaces. Or E, having an internalized moral sense of right or wrong. Well, I think the right answer here is A, to identify colors. You shouldn't expect a 4-year-old child to read. Um, Kids learn how to read at around age 6. You shouldn't expect a child to refuse to play with girls yet. That comes a little bit later at around 6 or 7 years old, all the way until puberty. And that's when they have a renewed interest in playing with girls. Tying their shoelaces, no, that requires more fine motor skills, so you shouldn't expect the child to tie shoelaces until they're about 5 or 6. And having an internalized moral sense of right and wrong, again, at about age 6 is when kids begin to understand that there are some things that are right and there are some things that are wrong in moral terms. Let's consider another question. A mother brings her normal 4-month-old child to the pediatrician for a routine examination. Which of the following developmental signposts can the doctor expect to be present in this infant? A, stranger anxiety. B, social smile. C, rapprochement. D, core gender identity. Or E, phobias. I would say here the right answer is probably social smile. Stranger anxiety is developed a little bit later. Rapprochement is developed much later, when the kid wants to be separated from their mother and then he decides to come back. Core gender identity, no, that's much later in development, and phobias too. So probably here it's social smile, and that is a reflex when for kids in their earliest phases of development, they smile, but it's not really a psychosocial response. It's more of a reflex response. Let's consider one final question from the USMLE Bank. A new mother develops a sad mood 2 days following the birth of her child. Which of the following factors is most likely to contribute to the development of this condition? A positive childbirth experience? No, not really. I mean, if she has a good positive childbirth experience, and that's not going to depress her. B, breastfeeding? No, again, probably breastfeeding has really no incidence on mood. C, feelings of decreased responsibility? No, it's actually quite the opposite. After a mother gives birth, she has a sense of increased responsibility. If she had a feeling of decreased responsibility, she wouldn't feel as depressed. D, changes in hormone levels. I think this is the right answer. Remember, mood have a lot to do with, at least in the case of pregnant women, have a lot to do with hormone levels. So changes in her hormone levels after having given birth will probably affect her mood. So the right answer here is D. And E, increased energy. No, after giving childbirth, mothers will be very tired because it's an exhaustive experience. So it's very unlikely that they will have increased energy after giving birth, and that will not influence her mood, and that really doesn't have an impact on the baby blues. So actually the right answer is D, changes in hormone levels. Will also be mood changes in pregnant women. And of course, there are also psychological changes when women are pregnant. I mean, this is something not entirely new for people who've already been pregnant, but especially for women who are pregnant for the first time. That there are big psychological challenges in there. So all those sources of stress and anxiety, but also happiness, all that can affect in mood changes. So in pregnancy, you should expect mood changes in women. And I can tell you from personal experience, I have 2 daughters, that yes, my wife went through some intense mood changes, and husbands have to cope with that. So it's a challenge for the women, but it's also a challenge for men. There are some cases of pseudocyesis, or as it's more frequently called, false pregnancy. Now, they are of very acute interest for psychiatry. In the past, they used to be called a hysteric woman uh, that became pregnant. That's the way it used to be referred. I dedicate a couple of lectures, but I must tell you that this is a very important aspect of psychology, of the field of psychology. And you as doctors need to be aware of some of the most important topics here, especially those of you that are planning to be pediatricians and also psychiatrists, because there are some disorders, some mental disorders that originate in childhood. So it's important for you to know what is normal in childhood and what is not normal in childhood development. So we'll take a look at some of the most important milestones and aspects of development as the child grows into older age. So let's begin with the period of life before you're born, and that is pregnancy. Well, during pregnancy, mothers go through some mood changes, and they can be due to two reasons. First of all, they can be due to hormones. As you know, during pregnancy, there is a lot of hormonal change involved. And of course, the psychological is the biological. Now, if there are biological changes in your body, that will ultimately also influence the way your mind works. So if there are hormonal changes, there is not necessarily a traumatic experience. And there are some myths about abortion that, if women really knew what it would be like to be pregnant, they would never abort. Or if women really knew what it would be like to have a baby, they would never do it because they're always attached to their babies. Although abortion is not necessarily traumatic, and there's no evidence that points out that really having an abortion will devastate your life. That's a myth put forth by people with an anti-choice agenda. It is nevertheless true that those women who do decide to have a child, they develop a very strong bond with the unborn child. So this is something that you physicians always need to watch for as well. I mean, and you need to be sensitive enough about the feelings of the woman towards the unborn child, because there is a very strong bond with the unborn child. Usually physicians recommend not having sex 4 weeks before giving birth because, well, the coitus movement could affect the health of the fetus. Men may be uncomfortable because of this. So, well, I can tell you. Now, that terminology is not used anymore in the clinical settings. They're now called somatoform disorders, and that is to say disorders, mental disorders that have consequences on the body. So the women somatize some of the mental stress that they may go through. And there may be a few women in the past when these women used to be called hysterics, some of them had false pregnancy. Now, there are some cases of false pregnancy, but they are very rare. And it may occur in women with a strong desire to be pregnant. So, their belly may increase, they may have the appearance of having a fetus inside their womb. They may even have some hormonal changes and mood changes, but when you run a pregnancy test, it turns out to be negative. So you as doctors should watch out for some false pregnancy cases. I mean, just because a woman has the appearance of being pregnant, that doesn't necessarily mean that she actually is pregnant. During pregnancy, women also develop a very strong bond with the unborn child. And although abortion... Hello, today we'll continue with our series of lectures on behavioral science. This will be lecture number 4, and we'll be covering the topic of developmental psychology. Actually, this topic will be divided in 2 lectures. The first lecture will be from pregnancy through preschool, and the other lecture, which will be the next one, will be from preschool all the way through death. I tell you in advance that my voice is a little bit hoarse. I mean, this is not the way I usually speak. I've had a flu recently, so my voice is a little bit affected. But I ask you to bear with me. And if you stay with me, I think we can pull it through. So, developmental psychology is an important aspect of behavioral science, and it mostly deals with the most important milestones in the lifetime of an individual. I mean, we all are born, we all grow, and we eventually die. In other curricula, this is sometimes called human growth and development, and there are curricula that include a complete course on this. Here we're only going to